It's Jennifer Warble, and this is my Think Aloud protocol. Okay, so the scenario is you've been asked to interpret for a nursing's program in a patient's treatment course. You are the interpreter, the gentleman in the blue shirt and tie, next to the nursing student and a deaf patient, who is a deaf volunteer acting as the patient. Okay, so demands that I can think of would be that the deaf client is laying down and he might not be able to have the best sight, so he might not be able to see the interpreter as well. The interpreter might need to position themselves so that you're able to see them better. The terminology could also be another demand, knowing like what words are being used and stuff. Another environmental demand is it looks pretty dark in the room and there's like kind of a glare off the table that could affect it. There's a lot of stuff going on. There's like all the machinery and all the different nursing tools and stuff. Let's see. Interpersonal between you and the client. I mean, if he's laying down trying to look up at you to receive all the information, because it's like a learning activity, I mean, you need to make sure that you're positioning yourself so that he can see you and get all that knowledge that's coming in. Let's see. Paralinguistics, his hand's kind of constrained. He has that IV up on his arm, so he might not be able to really move it a lot to sign. You might need to get that taken care of. He also, like I said, he's laying down, so he can't really move forward, like sit up. So that's also restraining him. Intrapersonal, maybe scenario or like the treatment course or whatever is wrong with the patient hits like a chord with you, like someone in your family has gone through the same thing, or you know someone who's going through it, and like it just kind of gets you emotional. There could also be a lot of chatter going on in the background. There seems to be like some people there observing, and you can see some of them are smiling, so you don't know if maybe they're talking. There's a lot of noise in the background that let's see. Let's see. Sorry, someone knocked on the door, so I kind of got me thrown off. Looking at the picture. I'm going to move on and then go back to that. I'll probably think of a lot more. So some control options. So for the paralinguistic, so how he's laying down with the IVs in his arm and clearly is like completely laying back and he can't really move. You need to make sure that you position yourself so that you're able to hear what's being said from the student, but also that he's able to see what's being said and you're able to send it clearly for him to receive the message. The darkness, it's really dark in this picture and it could be hard for him to see, but it also could be the opposite because it looks like the light is coming from behind and it kind of looks like it's really bright on stage as compared to behind where everyone's sitting, so it could cause a glare or like just be really bright for the consumer. So maybe you'll need to adjust your lighting. And let's see, and it also looks like in the room there's like a curtain that's blocking the window, so maybe you could open one of the curtains as to let more light in. And those curtains also, I mean, who knows what's on the other side? It could be another class doing the same thing, causing even more background noise, so you might have to, you're dealing with acoustics again, maybe just like positioning yourself so that you can, like I said, hear better. Terminology, definitely a control would be before the assignment to go over, like ask for whatever the schedule is of what they're going to be going over that day and maybe what the treatment course is going to be about, and do some research on that so you have that knowledge in your head, so like when it's said you're not as caught off guard. You're like, oh, I know what that is, and then you can go into explaining it. interpersonal, I mean, obviously like I said, if the treatment strikes a chord with you, I mean, you need to set that aside and continue to interpret regardless, or you need to let them know and use your discretion to let them know, like, I can't do this. It's something that is just really personal to me, and like remove yourself from the situation. You can have a team interpreter there maybe to help you out, since it's a pretty dense, I feel like a lot of like biology and like nursing programs tend to have pretty dense material, and like providing an interpretation for that is really hard because you really have to think about what the meaning of it is. It's not so much word for word, it's like what is a chromosome, what is a DNA, like, you know, just really explaining that. So it's really dense, so having that team interpreter can help relieve some of the stress. It can also help you if in the situation that you need to remove yourself, you can bring them in. Let's see. I think the main demand of this is just making sure that your student is able to receive the information. So I mean, it's their class. You don't know if they're going to be getting tested on this or have to do a paper on it or whatever. I mean, it's crucial information. It's a nursing program, which are pretty strict and hard to get into. So you want to make sure they're getting all that information. But things that can be going on around you during that time is like all the other students talking and conversing or asking questions. Let's see, the other interpreting. I mean, the other nursing student who's up there doing the patient treatment course on the deaf client. She could kind of, like, when she's doing things to him, she could maybe get in your way, so you have to keep positioning yourself, because she's like over here working on this arm, or over here working on this, and like the deaf client has to keep moving like his eyes to see where you are, like just making sure you're positioned right. Another concurrent demand could also be the sound. Like I guess I said that, the sound. The machines, the beeping of the machines could be another sound that could be happening. Let's see. So, demand control, interaction, and positive consequence. What is the interpreter going for? I think here the interpreter's, like I said, really going for getting the information out to him and letting him know what the treatment would be and how to go about treating that patient and making sure he gets all this information, because he's paying money to go to school here to get this information. So you want to make sure you're relaying that. But in the process of that, what could be forfeited from doing that? Just like trying to stay so on top of like getting that information out of there, you could maybe just confuse him more, or like mess up your signing because you're just trying so hard to get it out there, or like make it confusing to him. It could show in like your facial expressions, like you're just so focused on like the words and what she's saying, like trying to make sure that, oh, I heard this word, like what does that mean? I need to make sure I get out what that means. You might be losing like maybe your facial expressions, or just like your tone and stuff, and just becoming like that blank face conduit, just like a machine there. So you really want to make sure that you don't lose that, because that's really like one of the main features of ASL. A resulting demand, if there is one, maybe the student goes out and after you've interpreted this for him, he goes and takes his test and gets a bad grade on it, and he blames you for it because he thinks that you did not provide a proper interpretation, or you missed a lot of the concepts. And he writes to your boss and tells them that you should never should never interpret for him again, and that he wants you to be reviewed and all this stuff. that could be resulting demand. Another resulting demand could be, um, I'm gonna go to the next one. Number 7, practices guiding your decision. Remaining professional. He obviously wore his suit in professional colors. Um, his suit is contrasting to the background, so he made sure that there's good contrast and that the client would be able to see him. Um, what was revealed about the thought world of the consumer? And to me, like what I think that this person would be thinking is, I mean, the deaf client is on stage, so, or like up, like being the volunteer, so maybe he's thinking, oh, this is gonna allow me to get the most information. I'm not sitting back in this dark area, like in the background where everyone else is. I'll be in the light, be able to see the interpreter more clear. Um, and so that's maybe why he put himself on stage. He also wanted to get all that information in, so I mean, he's probably always going to be looking to you to make sure you're interpreting and make sure that he can see you. Um, let's see. I had to go back to the EIPI because I feel like I didn't cover that much on it. That was just really like thrown off at first. Trying to think of more demands that could be present in here. Let's see. I mean, maybe the teacher who's speaking, which we can't see in this picture, but I'm assuming there's a teacher there if it's a patient treatment course. Maybe they have some type of accent that like you're not really able to understand, so you have to keep asking for clarification, or interpersonal. Maybe your client is getting agitated because of how the other student keeps moving in front of him, blocking his vision, so he can't see you, and like he keeps having to move himself around, but he can't really do that because he's laying down, and he can't really sign to you because his arms have the IVs in them. Well, I think that is it.
Do you see her phone?
Yeah,
Okay, she wants it.
she put the timer on it.
Yeah. Thanks. Oh wait, I need a pencil. Alright. I don't really know where to sit. Because you can't see yourself.
Wait, which video?
Camera.
The white one?
Is it the white one? So do I just sit in this chair?
I would just, yeah, I would just roll.
Okay. Alright.
No, just roll back and forth.
Okay. Okay. Next to the nursing student definition of difficulty patient. Okay. Alright, so the demands for this scenario, starting with the environment. Well, there's lights on you, as you can see in the picture, so that might create a shadow since it's coming from behind. You have an audience in the back. They could be making noise, writing down things, asking questions, and your back is towards the audience. So usually in an interpreting assignment, you're facing the audience, but for this case, your back is towards the audience. So the deaf client is laying in the bed, and he's kind of propped up. His head isn't propped up that well, so you kind of have to get in there and sign. So the gentleman in the blue shirt and tie is the interpreter, which is who I am, and then the nurse's student is the nurse, and the deaf patient is the person laying in the bed. For the interpersonal, the client might not be able to see you very well. The light might be in his eye. He has an IV in his hands, a thing wrapped around his head, so that could constrain his signing and his movements. The nurse that's acting, or what's it called? The nursing student kind of has to work between the two of them, so that could create another dynamic as well. Moving on to the paralinguistics, it's going to be medical terminology, so you could be talking about any sorts of type of thing, IV, type of illness that the patient has, the different types of questions that the audience might be asking, because it's a patient treatment course, so all different types of questions about that, so medical terminology, that sort of thing. And then intrapersonal, the interpreter might feel queasy around doctor scenarios, or what else could there be? Maybe it makes you feel uncomfortable even though that the deaf client isn't injured, it would still make you feel, anxiety, or, because I know I have white coat syndrome, so I get nervous around doctors very easily, so that could be a factor as well. Just dealing with the terminology, dealing with just the situation, the questions, making sure that you're clear and able to, that the deaf client is able to see you when you're signing, that sort of thing. Moving on to number 2, the control options. So let's see here, post controls that I could do. I could brush up on my medical terminology. I could, since it is a seminar, I could see the room beforehand, see where I'm going to be placed, where the different people are going to be placed, just to kind of get a feel for the setup of the room. Again, look over medical terminologies. Just try to make, since since it is a seminar, make it as real as possible, that sort of thing. Controls implemented during the process. I can make sure that I'm standing in a proper position so that the deaf client can see me, as well as hear what the nurse is saying, as well as position myself maybe on the opposite side of him, like on the left side, so that I can see both the audience and him if they're asking a question. Let's see here, what else for the controls during? Going back to controls before, you could ask like the students, what the seminar is going to be about. You can ask the professor to hand you maybe a handout of what they're going to be discussing, that sort of thing, just to kind of better prepare yourself. So going back to the controls of during, I think that, I think that's pretty good for right now. I might come back to that later. Moving on to the controls afterwards. I could ask my mentor how I did or how else I could better interpret during a medical setting. With feeling anxiety, I could ask someone to help give me coping mechanisms for when I do feel anxious or do feel queasy, or if it's a very high-paced environment where nurses and doctors are running in and out of the hospital room, how I can remain calm. Just discuss strategies in that way. Again, review some medical terminology that I struggled with during the assignment. So figuring out what I struggled during the assignment can help with the post-assignment to figure that out. Practice, things like that. So moving on to the main demand. I feel that the main demand for this scenario could be, excuse me. Well, the main demand is being able to position yourself in a way that the deaf client can see the interpreter as well as see the doctor. So that's the main demand. Some of the concurrent demands could be that the audience are behind. The acoustics could be very bad. Maybe there's a microphone that the nurse has to wear in order to make the seminar audible for everybody to be able to hear it. The deaf client is constrained in his, he's in the hospital bed, he's supposed to act sick or act injured. So maybe he can only sign with one hand. So that could be an issue too. The lighting, again, like I said, the way he's laying down, his eyes are closed in this as well, I'm just noticing that. So maybe you have to get his attention every time the nurse says something, or work with it that way. So number 5, what was forfeited as a result, or positive and negative consequences. The control for my demand would be to, I think his positioning is okay right now. He is standing next to the nurse. I think that him and the nurse should switch spots so that he's closer to the deaf client, as well as being able to see the audience as well if there's any questions. A positive for this would be that the deaf client would be able to see him and see everything that's going on. A negative consequence could be that the nurse and him would constantly have to, switch back and forth, or she'd have to go to the other side. But what if she needs to change something in his IV that's on his right arm, even though it looks like his IV's on his left arm? If she needs to get to his right side, they have to constantly switch. So you can be in the way. And then a resulting demand for that, I feel, just, figuring out the best position to be in for that particular scenario. Number 7, practice values guiding the decision. Well, for hospital settings, I feel, like I said before, it's very high intensity. There's a lot of things going on. Usually people aren't in the hospital for good things unless they're delivering a baby. But then again, it's still high intensity. But the types of emotions that occur, both from the doctors, the nurses, the patient, all I feel is very stressful and scared and nerve-wracking. So I feel like, as the interpreter, I would want to remain calm and be able to do my work effectively and efficiently while not being in the way, giving the deaf client the information that they need to know, and as clear as possible. Because it can be scary to go to a hospital where nobody speaks your language, you don't know what's going on, and the one person you can depend on is the interpreter. So being able to have the interpreter be that person, I feel like that's the reason why I would position myself in a way where I can make the deaf client feel comfortable, be able to interact with the doctors and nurses that are around. And what was revealed of the thought world of the consumers, kind of like what I said before, how, as the deaf client being injured, you're the one person that they can depend on for information. So maybe, they have a lot of trauma and they're scared and don't know how to deal with the situation. You're the one person that can speak their language. So just understanding that if you